Talking health now. It is true that certain kinds of infections can be contracted from toilets. The layman calls it toilet infections. Women, they say, are more prone. Tonight we focus on the kinds of infections that can be contracted from simply using a toilet. How can anyone know that they have contracted such infection, and what are the preventive measures? Joy Kena Bakboya reports.
There's nothing worse than desperately needing to go to the toilet when the options are public parks or service stations. Many people hover over the toilet seat, squat, hold their breath and try not to think of the disease-causing germs that are probably crawling all over the seat and bowl. This is because a dirty toilet is seen as a vehicle for transmitting infections to humans. This conception has given rise to what many now call toilet infections.
You can contact gonorrhea there. You can contact gonococcus. You can contact staphylococcus. You can contact different diseases.
Some of the signs you see are itchy. When you start feeling itchy in your private part, sometimes you discharge, you have a mucus discharge or some smelly discharge and all that. So these are signs you get and you know that yes, you have that toilet infection.
But against the belief of these respondents, medical experts say fecal-oral diseases are the major infections that can be contracted from using unhygienic toilets. These diseases include streptococcus, a throat infection, E. coli, hepatitis A, common cold, and staphylococcus, a skin infection that causes boils and cellulitis.
Toilet infection, if you want to look at them, yes, they are things like Shigella. It's a kind of, organism that you can contact out of unhygienic environment, toilet use. Okay. Do you understand what I'm saying? And it comes when the patient has it. It has some kind of abnormal, dysentery. They have dysentery. The stooling is not normal. There's a kind of stooling, frequent stooling, is like greenish, occasionally mucoid. And E. coli. Do you understand what I'm saying? E. coli now, these are things that they are found in the guts. They are not found in the vagina. They are not found in the urethra. They are from the mouth to the gut, then to the anus.
From not washing hands and things, one can get cholera, you can get hepatitis A, which is foodborne and not, but they are all, things that go on with our fingers. So any infection that one can get orally can actually be gotten through there.
Experts, however, say these fecal-oral diseases are not limited to the toilet seat and bowl. They say by touching doorknobs and handles, toilet surfaces with fingers, and not washing hands after using the toilets, one can be infected.
The railings, the handle of the doors, they are contaminated, the toilet seat is contaminated. Then somehow, there's a kind of fecal-oral transmission. The hand is contaminated, there's no proper hand washing, the patient eats, you can have diarrhea.
On the common belief that sexually transmitted diseases can be transmitted through the toilet, experts have this to say.
Most sexually transmissible infections, like Neisseria gonorrhea and chlamydia, they are sexually transmissible. They are not from the toilet. They will not necessarily come from the toilet. They come through. That's why they are called sexually transmissible infection. So they will not necessarily come from what they call toilet, so-called toilet. So there's only like toilet infection. Yes, people can have yeast infection, which is the commonest cause of vaginal discharge. People can have yeast infection from the toilet, and they can have it from anywhere, not necessarily toilet.
What you can get from a dirty toilet is very, very different from sexually transmitted infection. You won't have urethral discharge because you have used the toilet. The worst case that a woman can have is just candidiasis. If a man has urethral discharge, that discharge should be cultured.
While you don't need to worry about picking a sexually transmitted infection from a public convenience, experts say washing and drying hands after using the toilet is one of the most important factors in stopping the spread of digestive diseases.
Make sure the toilet is kept clean, they are properly handled, you use disinfectant to wash them. There should be running water in every toilet, disinfectant, soap, there should be tissue papers and all of that.
Medical experts say if you have to use a public toilet, wipe the toilet seats with tissues or water before sitting and wash your hands after use.
Point to note, infections can be contracted anywhere. We need to keep a clean environment. And thanks for that, Joy.